Orthopedics, the knee part 2. Previous patella patelectomy, that means removing the patella, usually post-traumatic. They don't usually do that well post-op. Here's a maltracted patella fixed with 3 incisions, so loosen on the lateral side or release, tighten on the medial side and shift the patella tendon insertion, trying to shift everything medially. Patellofemoral replacement, it can be quite good surgery. There's patellofemoral replacement time of surgery, the femoral component, the patella component. Tear of medial retinacular structures, patella dislocation. Patella tendon avulsion, so needs surgical repair. Avulsion, but patella tendon for lower end of patella. 15-year-old child treated non-operatively, had good strength. Posterior sag, PCL injury, posterior sag, PCL injury. See? Posterior sag, if it's anterior, be going forward. PCL injuries, a bit controversial whether you should repair all of them or only whether they're isolated. Pellegrini stida is just a calcification of the medial collateral structures. There's a plica on the medial side of the knee. They're just vestigial synovial faults. Psoriasis region of the knee, quite common. Don't want to operate through that. Bilateral genu valgus, rheumatoid usually. Is an Elizaroff frame for correction of genu varus in a child. Good frame, needs a high technical expertise to apply. Uni knee replacements do well. Hamstring tear, MRI positive in a 60-year-old patient, treat non-operative. Avulsion upper polar patella would require internal fixation. Rupture rectus femoris above the knee. You can break the quadriceps in those patients here. See the defect here? Need to repair this, otherwise they'll lose a lot of power. Tibia vera, prone to arthritis of the inside part of the knee. Here corrected with a valgizing osteotomy. Total knee replacement, OA. Knee replacements are very good for OA of the knee, rheumatoid of the knee. You have to pay particular attention to the balance of the components and the patella. Navigation is commonly used now. The revision cases are very difficult to deal with because there's a lot of bone loss. Well, here's one complicated by suprachondral fracture. Had to go back to theatre later, internally replaced. Here's a insulbursine implant. Our patient ended up with amputation for a vascular problem. There's the implant. Malignant one, good type of knee replacement. Bilateral knee replacement can be done very hard for the patient to recover. Here's a cemented spacer, effective total knee replacement. Try to get all the tissues quiescent, put a cement spacer in there to preserve the space, then come back and do a knee replacement. Here's a dislocated failed no knee replacement. So it's dislocated subluxed, so I have to revise that situation. There's a below knee amputation. And he had a knee replacement dislocated, but he'd also had pre-existing below knee amputation. Dislocated knee, quite unusual. Dislocated knee replacement. There's an old type of knee replacement, gun stock, hinged, loosened. It'd be quite a challenge to revise that. There's a revision situation, major resection of the bone, implant. See, a total knee replacement, the femoral component, tibial component, plastic spacer, patella replaced. Doing bilateral cases. Here's a rotoglide knee, very good one. Mobile tibial bearing plate. Previous scars, you have to plan it very carefully when you're going to do your surgery, otherwise you end up with an avascular segment of the skin. Gunshot injury to the knee, debris multiple times. Avoid compartment syndrome, get fragments out. Tumour in the region of the knee, not uncommon. Giant cell tumours, here's a resection for chondrosarcoma. You're going to be left with a lot of bony loss. Here's another giant cell tumour in the region of the knee, initially fractured, initially internally fixed, realised it was a tumour, resected. Here's an osteochondroma in the region of the knee. He's a husband and wife pair post-uni knee replacement, did well. He's a fracture around uni knee replacement, would need to be revised to a total knee replacement. Hope you enjoyed that series.